Good morning. My name is Lisa Croft, and this is my PowerPoint presentation for my Healthcare Ethics class case study paper entitled Code of Ethics in Practice. This case study takes place in an acute inpatient dialysis unit. The department was short-staffed and was seeking to hire a new nurse. The nurses were divided on their decision between an RN with experience in the hospital or with an experienced outpatient dialysis nurse, and you would either teach them the dialysis part of the job or you would teach them the hospital side of the job. The decision was made to hire an outpatient dialysis nurse that had 10 years of experience as an LPN and 3 years experience as an RN, but had never worked in a hospital setting. After the nurse was hired, she was very excited and ready to start work and seemed to be fitting in really well. But that was very short-lived and things changed rapidly. She began leaving work for others to do. She had excessive personal calls at work, she would stay on the phone for long periods of time. She would ignore patients' needs when they would ask something. She would tell them a minute, wait a minute, and end up someone else doing it. She had very little knowledge of the hospital equipment, just to set up suction or oxygen or those kinds of things. And she really had lack of critical thinking skills. When patients would start going bad or something of that nature, she would just walk away. And she didn't really have good assessment skills, and problem resolution was a huge issue for her. The staff became very upset, and they posed multiple complaints to their department manager, and really nothing ever came of it. Nothing was ever done. And the end result of the whole thing, it went on for months, and finally the nurse did resign her position, and she stayed on in the department as an as-needed PRN nurse. None of the staff ever called to have her work, so ultimately she was terminated. The first thing I'd like to discuss is the ethical inquiry into this case study. Provision 6 calls for nurses to create and maintain an ethical work environment where quality health care is provided with patient safety as a top priority. With that being said, an ethical environment encourages effective communication, kindness, respect, and equality. Some of the ways this department as a whole did not maintain this environment are: the staff and nurse did not communicate effectively to attempt to resolve the issues. The staff nurses stopped showing kindness as the situation progressed. Equality was not maintained when the workload was not evenly distributed, and neither the nurse nor the staff was respectful to each other or to their environment. The second part of Provision 6 focuses on that the environment will provide quality health care and that patient safety will be a top priority. It says that in an ethical environment, nurses are to display moral character in the forms of skill, knowledge, honesty, compassion, and wisdom. How the nurses and staff failed to do these things: the first one is the nurse did not display skills and knowledge required to perform her job. The nurse was not honest with the staff in the hiring process. The staff did not show the nurse compassion. The staff did not display wisdom in handling the situation, and the patients were at risk for not receiving the quality and safe care that they deserved. The Code of Ethics also says that nurses are obligated to possess accountability, responsibility, and integrity. The nurse did not acknowledge any accountability or responsibility for her actions. Secondly, feelings of powerlessness and frustration anger, they're commonly expressed when organizational and administrative support is lacking in dealing with ethical issues. The department manager ignored her responsibility for the new nurse. The staff was very angry and frustrated, and the staff should have sought further means to report the situation. In interpreting the Code of Ethics Provision 6, I got from it a few different points. The first one is the Code of Ethics indicates that the potential exists for the workplace to be a morally good environment, resulting in minimal moral distress. The next point I took away from it was, for a team to be effective, the members must commit to the work involved, use clear, effective communication, actively listen, and cultivate trust. And lastly, if the nurses were not able to find resolutions to ethical issues, the Code of Ethics instructs nurses to seek assistance through the proper channels of their organization. In applying the Code of Ethics Provision 6 to this case study, we found a few things to be true. That the staff nurses failed in proper execution of interventions to resolve this issue. An intervention could have been performed to encourage the nurse to address her issues of impaired practice. The staff should feel safe to discuss ethical concerns and should have been able to address the situation with the nurse without being angry, accusing, or threatening. It is the department manager's duty to address the concerns and initiate the appropriate resolution. And the nurse failed her new team and her commitment to the title of nurse. She did not display dedication, accountability, honesty, integrity, or her obligation to maintain an ethical work environment. Some of the ethical implications of this situation could be, firstly, moral distress. Some of the ways the nurses could feel moral distress from this issue is that the staff felt that the ethical and safe treatment of their patients had been compromised due to the actions of this nurse. And also in the fact that their manager did not help them to resolve the situation, even though they requested assistance multiple times. A few other ethical implications would be that the team should work together to identify the actions that were handled poorly, and a plan should be developed on how to address situations like this in the future in a professional and effective manner. And another implication would be the intactness of the department as a whole should be addressed by the staff in hopes of regaining the harmony that has existed prior to this situation. I believe that the nursing practice implications can be summed up in a statement saying, nurses must provide an environment where ethical dilemmas, professional relationship issues, and the myriad of workforce challenges inherent within the healthcare environment can be acknowledged and addressed with resolve. The nurse practice recommendations for this case study are that setting an example is the best way to teach others how to practice upholding the provisions of the Code of Ethics. And also, the team should reflect on and analyze the actions demonstrated during this issue to improve their responses to future moral situations similar to this one. In conclusion, the Code of Ethics instructs in the promotion of a respectful work environment where nurses encourage ethical behavior and effective communication, which delivers a positive and safe environment for nurses to practice. The ethical climate is changing daily, so nurses must constantly stay diligent in their efforts and desires to keep their environment an ethical place to practice. Nurses should realize they're not alone in ethical situations. They should actively seek guidance and assistance with ethical issues as they arise and be assertive if necessary to obtain resolution. The next slide is a list of my references for my paper and PowerPoint presentation.